So what I hope to cover over the next 20 minutes or so is really going through the definition of exercise and physical activity. And we can use these interchangeably, but I just want to clarify what those definitions are. Further discuss the benefits of exercise and how potent it really can be for individuals who are trying not to go with pharmacological intervention, or if they are using it, how to enhance that to include insulin as well. And then the physiological response to exercise, we'll talk both about type 1 and type 2 diabetes and, of course, gestational diabetes, risks and cautions of exercise for people that have diabetes or have GDM, and then principles of an exercise program followed by how one would actually design an exercise prescription. So my goal is to empower all of the listeners to have some take-home items that you really feel you can give your clients as you move forward. So the definition of exercise versus planned activity, typically when people think of, oh, I have to schedule exercise, this may be a stumbling block, or they feel like my plate is so full, how can I possibly put one more thing on? So really trying to gauge with your client if they're willing to schedule these regular appointments and talk about just enhancing their activity levels, their physical activity. So whichever angle you take, be sensitive to how they are going to receive what you're asking them to do. So physical activity, also known as PA, we talk about it a lot in the research setting as PA, or exercise is an incredible, powerful management tool. And I think if you engage your client or patient in this language of what an incredible opportunity to use something so potent and so powerful, and you can, use it and stair-step your way into increasing the dosage, in other words, doing a little bit more for a little bit longer every day, think about how it really will get you towards those ideal blood glucose levels that we're talking about. And then, of course, those small baby steps, helping them to realize 5 or 10 minutes every day does have an impact on their blood glucose levels. And especially those who are kind of moving into their 20, 25 weeks of pregnancy, they still are quite able to titrate themselves up to 30 and 50 minutes per day appropriately before they get to that 8th month or 9th month. And then, of course, how it will really help to ease delivery, adding muscle and strengthening exercises. Different types of exercise, we typically break these down into what we call cardiovascular, cardiopulmonary, which is the category of aerobic exercise using oxygen in a continuous, moderate level. And this is really a definition that if you explain it to your client, they're going to say, oh, that's like walking or biking or jogging, or they can kind of get in their mind something rhythmic and continuous. And then that coupled with something that is more of a burst of energy, and it's isolating specific muscle groups. So we usually typically identify anaerobic exercise as resistance training, really fast bursts such as sprinting and that sort of workout, a real intense stop-and-go workout, if you will. And we really want to engage them, of course, in stretching and flexibility in conjunction with aerobic and anaerobic. The benefits of aerobic exercise are many, and many of, I think, your clients will know what some of these benefits are, but they love to hear what they are. So I encourage you to talk about some of the perks outside of glucose control that they might get. So improving their lipid profiles, lowering their blood pressure, and improving their physical work capacity, their balance, their capability of maybe doing more housework, feeling better. Assisting in weight management, I know many of our clients have that concern, and so this is a real empowerment tool to put in place before baby comes, and then after baby comes, really helping them to understand they want to maintain what they've put into play during their pregnancy. Of course, the preservation of lean body mass, and this is what gives us the slim physique and really helps us to feel strong. So enhancing that muscle strength and musculoskeletal integrity as well. And then enhancing things at the cellular and tissue level, especially when we're looking at the sensitivity of insulin. Exercise is a natural insulin sensitizer, and this is really the potent take-home message to help them realize that instead of injecting insulin or in conjunction with their insulin injections, exercise can really enhance and couple what they're trying to achieve. And last but not least, the psychological benefits, just improving quality of life and their sense of well-being is also something to discuss. So then the benefits of the resistance, or what we call anaerobic, so this is not utilizing exercise in a continuous rhythmic manner where you're taking in oxygen continuously. This is a burst of energy. This is like a 5 or 10 squats. It may be wall push-ups. You can think about a woman that's pregnant, or at least maybe 20 weeks pregnant, the types of things that she can do that would be very appropriate. Typically, we would like to keep their head above their waist, and so any type of exercise where they can either sit on the ground and do, sit in a chair and do, or do against a wall is more ideal for this type of individual. So again, increasing bone and connective tissue strength, improving their gait stability, and then pregnancy, this is a big deal. Just as they take on this sort of imbalance, how they can better gauge, especially if they have that muscle memory because they've been doing some of those squats and lunges. And then the risks of falls are decreased. They have improved physical work capacity and improved muscular strength, power, size, and endurance. So you're welcome to use this. This has been a very effective teaching tool, and even when I haven't had any teaching materials in front of me, if I can draw a picture either on a piece of paper of a circle, and I say, this is a circle, this is like a pie, how would you divide the pie as far as importance? Because we typically think of 3 different areas of controlling blood glucose levels, and they are pharmacological, drugs, so medications, including insulin, diet, of course, and then exercise. And it's fascinating to have this discussion with them because initially, when they think about what's the most important, it really depends on how they're controlling their diabetes at that point. But then as they start learning from you and educating them on how important exercise could be and should be, they realize that it's becoming a good 1/3 of the pie, if not half of the pie. If they're not taking any pharmacological agents, then of course half diet, half exercise. And I think that's a really effective teaching tool. So a little bit about how what's happening physiologically in the body when one begins to exercise. In normal fuel regulation, this is what we expect. The regulation of these fuel substrates, these are counter-regulatory hormones largely, the orchestration of insulin and glucagon, catecholamines, including epinephrine, norepinephrine, growth hormone, cortisol. These are all trying to adjust accordingly based on what the demand of the body is happening as we increase our cardiovascular, our heart rate increases, the consumption of oxygen increases, and so the demands start adjusting based on how we need to distribute fuel differently than if we're sedentary or not demanding a lot of physical activity out of ourselves. We also see that skeletal muscle has a 10 to 20 time increase in energy demand. So you can imagine the muscles are kind of going from ground zero to a demand where, hey, we actually need some fuel now, whereas we haven't needed much fuel. So that's why 10, 15, 20 minutes of exercise every day or 10 minutes after every meal can really impact their glucose control. And then, of course, the glucose demands in the muscle that are used in the first few seconds are usually higher than those once we get regulated in aerobic-based exercise. Glucose and fat is used during low to moderate intensity, and this is really ideal for individuals that are pregnant because lots of times they are really trying to maintain this behavior even after the baby comes. And then glucose in the liver is used during high intensity. After exercise, we see an ongoing increase, and this can last. Some of the literature even shows potentially well past 48 hours, so you can imagine that you're still reaping some of those benefits, and blood glucose is definitely being affected 2 days after one goes and exercises. And, of course, there are parameters that impact this, intensity being a big one and duration being a big one. Enhanced insulin sensitivity, and this can happen for 5-10 hours post-exercise. So having one gauge and check those blood sugars are really important for them to see how their body responds to exercise. Glycogenesis is peaked tissue to muscle being saturated, and we see the best opportunity for carbohydrate replacement within 20 minutes, and even 20 to 40 minutes after glycogen synthase activity. But really, I think most individuals that are doing this type of research are really leaning towards the sooner the better. Glucose regulation and exercise, you can see here what's happening at the liver and the counter-regulatory hormones in a normal individual versus somebody who has diabetes. And the hepatic output and the peripheral utilization is constantly counteracting, trying to find a balance, but typically this balance is upset in somebody that has diabetes. And so it can be somewhat unpredictable. And so checking blood sugars is absolutely important when you're giving an exercise prescription initially and an individual is really trying to determine how does my body respond to exercise with pre-existing diabetes, with gestational diabetes. And then several factors are involved that cause a disruption in glucose homeostasis. These largely are the sympathetic nervous system with in the orchestration of the counter-regulatory hormones. So an individual that has pre-existing diabetes, the glucose regulation and exercise, typically we see the body respond when somebody starts exercising with a blood glucose level being pulled down. That's very typical. That's what the normal response we would expect. Hepatic output decreases and peripheral utilization increases because of that insulin sensitizer impact that's happening when the body starts demanding more than it would at a sedentary level. We see insulin use increase, and we also see the counter-regulatory hormone response across the board decrease. And then, of course, as a whole, if one was to check their blood sugars, we would see blood glucose decrease, and this may even be maintained for a substantial amount of time, 10, 12 hours.